Hello, and welcome to today's special discussion, where we're diving into some of the most critical conversations happening in the medical field today. From the rise of telemedicine to the challenges of antibiotic resistance, from the mental health crisis to the impact of genomics, these issues are not only shaping the way we approach healthcare, but also determining the future of how we stay healthy. In this in-depth discussion, we'll explore each topic in great detail, examining the strengths, weaknesses, and potential solutions to these pressing issues. Let's begin. Let's start with one of the most significant shifts in healthcare: telemedicine. In just a short period, telemedicine has skyrocketed in popularity, particularly during the COVID-19 pandemic. But as we look to the future, how will telemedicine fit into our healthcare system in the long term? Is it effective for everyone, and what are the challenges we face with this model?
Telemedicine is indeed a transformative force in healthcare. The idea of being able to consult with a doctor from the comfort of your home is incredibly appealing, especially for people in remote areas, busy professionals, and those with chronic conditions. It allows for more flexibility in scheduling, reducing the strain on in-person appointments. However, there are limitations. For starters, telemedicine isn't suitable for all conditions. If someone is experiencing acute symptoms or needs a physical examination, it's simply not enough.
That's right. Plus, there's the issue of healthcare accessibility. Not everyone has access to reliable internet or the technology required for virtual appointments. And for many people, there is a lack of familiarity with technology that makes telehealth services a challenge to use effectively. There's also the concern of data privacy. With telemedicine platforms, we're dealing with sensitive personal health data that needs to be securely stored and handled. How do we ensure that the data is not being compromised in this increasingly digital world?
Exactly. And while telemedicine can be effective for some routine checkups, we're still trying to figure out how to best balance it with the need for physical interactions between patients and doctors. It's a matter of finding that balance between convenience and comprehensive care.
It sounds like there's a lot of work to be done to perfect telemedicine, particularly in ensuring equitable access, privacy, and adapting it for more complex health needs. Mental health has become an increasing focus for both medical professionals and society as a whole. The pandemic certainly contributed to this growing recognition. But why do you think it has taken so long for mental health to receive the attention it truly deserves? And how can the system continue to improve in terms of addressing mental health as a core component of overall well-being?
Mental health is something that has often been pushed aside in favor of physical health. For decades, it was treated as secondary, and the stigma associated with mental health conditions made people reluctant to seek help. But in the wake of the COVID-19 pandemic, it became abundantly clear that mental health and physical health are deeply interconnected. The pandemic revealed the importance of supporting mental health, not just as a response to crises, but as an ongoing foundational element of our overall health.
Right. And one of the biggest challenges we face now is reducing the stigma. For too long, people have been made to feel ashamed of their mental health struggles. The conversation is shifting, but there's still so much work to do. One area we need to focus on is integrating mental health services with primary care. People often go to their primary care physicians first, so it would be much more efficient if there was a system in place where mental health professionals were more easily accessible within that setting.
Absolutely. Another issue is burnout, particularly among healthcare workers. Many of them are struggling with their own mental health as they deal with high stress, long hours, and emotional fatigue. We need to look at better ways to support the mental health of healthcare providers so they can continue providing quality care.
It seems that mental health has now become a priority, but there's still a long road ahead. We need more structural change to ensure that mental health is not treated as an afterthought, but as an integral part of overall health. Now let's delve into a more complex issue: health inequality. It's no secret that healthcare access is not equal across the board, especially when it comes to race, socioeconomic status, and geography. How can we address these disparities and build a more equitable healthcare system?
The disparities in healthcare are vast, and it's something that has been overlooked for far too long. For many people, especially in low-income communities, accessing quality care is a challenge. Whether it's a lack of insurance, transportation, or cultural barriers, the healthcare system often doesn't meet the needs of these communities. It's critical that we shift our focus from just treating illness to focusing on prevention and wellness. Ensuring that everyone, regardless of their background or where they live, has access to the care they need is paramount.
Right. And we need to address the social determinants of health, such as housing, food security, and education. These are foundational factors that directly affect people's health outcomes. It's not enough to just fix the healthcare system. Health inequality is a broader issue that requires a multifaceted approach. We also need to consider expanding healthcare coverage for marginalized groups and working towards creating policies that ensure more inclusive healthcare systems.
So it sounds like solving health inequality requires addressing both healthcare access and the broader social factors that influence health outcomes. It's a huge challenge, but it's something that can't be ignored. Let's shift to a topic that's been making waves in recent years: personalized medicine and genomics. Personalized medicine, which tailors treatments to individual genetic profiles, has shown a lot of promise. But where are we in terms of implementing genomics on a widespread scale?
Personalized medicine is one of the most exciting developments in modern healthcare. By understanding a patient's genetic makeup, we can make more accurate diagnoses, predict disease risks, and tailor treatments to be more effective and less invasive. Genomic testing is already being used in oncology and rare disease diagnosis, and the potential for it to revolutionize healthcare is immense.
The challenge, however, is that we're still in the early stages. While genetic tests can provide valuable insights, there's still a lot we don't know. We need to be cautious about how genetic information is used. There are ethical concerns regarding genetic data privacy, and we need clear regulations to ensure that this data is protected.
Exactly. The promise of genomics is there, but we need more research, better understanding, and proper safeguards before we can fully embrace personalized medicine on a broad scale.
Let's now touch on an issue that is growing in urgency: antibiotic resistance. As we see more bacteria becoming resistant to the antibiotics we use to treat infections, how can we address this threat?
Antibiotic resistance is one of the most critical public health threats we face today. It's happening because antibiotics are being overused, often inappropriately. People sometimes take antibiotics for viral infections where they don't work, and this contributes to resistance. We need to be much more mindful about how and when we use antibiotics. More responsible prescribing practices are necessary to prevent further resistance.
Exactly. And the development of new antibiotics is slow and costly. We need global cooperation to tackle this issue, as antibiotic resistance doesn't recognize borders. It's not just about individual countries. It's a worldwide problem that requires a coordinated global response.
Let's talk about the future of healthcare: artificial intelligence, or AI. How is AI changing the way medicine is practiced?
AI is transforming healthcare in many ways. It's being used for predictive analytics, diagnostics, and even robotic surgeries. With AI, we can analyze vast amounts of data much faster than a human could. This allows for early detection of diseases, personalized treatment plans, and even the ability to predict patient outcomes with high accuracy.
However, AI is not without its challenges. One of the biggest concerns is reliability. AI systems can only be as good as the data they are trained on. If that data is biased or flawed, it can lead to incorrect diagnoses or treatment recommendations. The role of human oversight is critical in ensuring that AI complements rather than replaces human judgment.
As we've seen, the future of healthcare is full of challenges but also incredible opportunities. We're entering a new era of medicine where innovation and technology are transforming the way we deliver care. But the key will always be to balance progress with ethics, accessibility, and patient care. If we can navigate these challenges, we have the chance to create a healthcare system that works for everyone. Thank you for watching. Don't forget to subscribe and stay tuned for more insightful discussions on the future of healthcare.